Hi there, my name is Melissa and I'm a laser technician at Cutis Cosmetic and Laser Center in Dundas, Ontario. I've decided to have a Fraxel Dual resurfacing treatment so I can show our clients exactly what to expect both pre and post treatment. The Fraxel Dual has two different wavelengths. The first wavelength is the 1927 and that's designed to treat pigmentation, actinic keratosis, which are precancerous lesions, as well as to have a general resurfacing effect to tighten the pores and smooth the texture of the skin. The second wavelength is the 1550. The 1550 is designed to stimulate the production of collagen and elastin. For that reason, it's actually better for a client who has deeper lines and wrinkles, or if they have concerns with laxity in their skin, they're looking to have more firmness, or even for the clients who've had surgical scars or even deep-pitted acne scarring. So, if you look at my skin, you'll see I'm not currently wearing any makeup. I have quite a bit of hyperpigmentation, sun damage. I also have a very oily, acne-prone skin. When I look in the mirror, my pores are quite large and they always have a tendency to clog with blackheads and whiteheads and pimples. Because of these concerns, Dr. Edstrom, our cosmetic dermatologist, as well as Dr. Lemckert, our facial cosmetic surgeon, have recommended that I have a series of 4 Fraxel Dual treatments with a 1927 wavelength. Remember, the 1927 is designed to treat pigment as well as to have that general resurfacing effect. We usually suggest that our clients have a series of about 4 treatments for best results. We will customize this treatment for each individual that comes in, but on average you require about 4 treatments spaced 1 month apart. So now that I know what wavelength I need, the 1927, the next step is to begin preparing my skin for the treatment. We usually suggest that our clients have an exfoliating treatment done 2 weeks prior to the Fraxel treatment. This could be something as simple as having a Silkpeel microdermabraision to buff away at that dead skin cells, or it could be a Skinceuticals chemical peel where you have salicylic acid or glycolic acid gently lifting away those dead skin cells. Both of these treatments are optimal because they remove that surface layer of dead cells and debris, which will allow the laser energy to penetrate more evenly as well as more deeply into the skin, which means you'll get better results. Finally, it's important to consider what type of products that you're using at home. Here at Cutis, we suggest you use Skinceuticals medical-grade skincare products. Their philosophy is very simple and very easy to follow. First, we're going to have prevention. Secondly is protection. And thirdly is correction. So, step 1, prevention. In the daytime, I'll be using the Floratin CF. This is a daytime antioxidant vitamin C serum that I can be using to prevent damage in my skin. Vitamin C serums work the exact same way as if you have lemon juice and you put it on an apple slice. It prevents oxidization, so it makes sure that apple slice doesn't get brown and wrinkly. This same premise can be applied to our skin. So basically in the morning time, you would apply the Floratin CF. It's in a convenient little dropper form with a few drops. You would place it onto your skin and it absorbs in beautifully. You barely feel it. Finally, for step 2, you're going to be doing the protection. So this is the Skinceuticals SPF 50 mineral sunscreen. It contains titanium dioxide and zinc. The nice thing about it is that it's actually a very light type of fluidy texture, as you can see. It also has a nice flesh tone skin colored tint to it. So instead of looking white and cakey like some of those traditional mineral sunscreens, it actually looks very nice and natural when you have it on the skin. The last step is the correction. We usually suggest our clients have in the nighttime an exfoliating serum, which will help lift off some of the damage on their skin. For my skin, because I'm more oily, acne prone, we have selected for me the Blemish and Age Nighttime Serum. It contains a mixture of dioic acid, salicylic acid, and glycolic acid to tighten up my pores, control oil, and remove some of those dead skin cells. We will customize a treatment plan that's suitable for each client as they come in, so one that's appropriate for their skin type and their concern. So, now you know the difference between the 2 Fraxel wavelengths. You also know how to prepare your skin for treatment by having an exfoliating treatment and by also using your medical skincare or medical grade skincare. Now it's time for me to have my Fraxel Dual treatment, and I will check in with you guys immediately afterwards so you can see exactly what my skin looks like. So we'll talk to you soon, and thank you for watching.